Hi, I'm Sarah, and I am here with Jordan and Bella here at Hebron Animal Hospital, some veterinary assistants, and we're also here with Baloo, a little friendly cat. And sometimes our clients have some questions about what actually happens during a cat diagnostic imaging appointment. We've written down a few questions, and we are here to answer those for you. First question, does my cat get anesthetized for diagnostic imaging?
So it kind of depends as far as the temperament of the cat. A lot of times, especially here, since we're fear-free, we don't want to stress them out more than necessary. So if anesthesia is required to kind of calm them down and prevent them from having a stressful memory from being here, we can do so, and also to prevent them from moving around and making it more difficult for us to actually get the x-ray. But most of the time, we can actually do it without anesthesia and just kind of give them a firm hug and get the pictures done that we need to do without putting them under, as long as they're okay with it.
What happens to my cat during an x-ray?
So during an x-ray, we usually just position the cat, either depending upon what we're x-raying, on the back, the stomach, or on either side. And we basically just kind of hold the limbs firm and the head firm and make sure the body is still enough to get a picture. It takes maybe 5 to 10 seconds to actually get the picture. We'll rotate and do what we need. And a lot of the times they're pretty cooperative for something like that.
Will my cat experience pain during a cat diagnostic imaging?
They won't. So there may be some painful areas that we're trying to take a peek at, whether it be like an abdomen or a limb of some kind. We do our best to try and make them as comfortable as possible while we're taking the x-ray, just because we know we don't want to, again, stress them out any more than we need to or cause any further pain or damage to whatever is bothering them that we're x-raying today. But most of the time, we may get a few meows or a few barks if we're x-raying a dog. But a lot of the times, we don't cause any additional pain to them.
How can x-rays help my cat?
So x-rays specifically will look for things like any foreign body objects that an animal has swallowed, or even if there's any masses inside the abdomen or the thorax that we have to take a peek at. And even we can look to see like comparative imaging as far as if we got x-rays in the past, if anything's changed or moved around since then. We can also look at things like calcium deposits because those will show up pretty well. And a lot of things that shouldn't be there is most of the time what we're looking for on an x-ray.
What happens if there is still no diagnosis after cat diagnostic imaging?
A lot of times we will proceed with further diagnostics. One thing we can do is an ultrasound to kind of give us a live picture of what we're looking at on an x-ray and see how things are moving, how things are functioning, and exactly where certain things might be positioned. If not that, we can refer them to a specialist or a radiologist to get further imaging to see what's going on and have someone who specializes in that field in particular to take a peek and see if there's something that we just can't see on our x-rays here. Anytime we want to see a back leg on an animal, we'll put them in a lateral position, like we would do a lateral x-ray. And we'll make sure that we kind of center their hips and their pelvis in the middle of the field. And we'll stretch one leg back, and then we'll pull another leg down. I know, he's okay. Just making sure that our hands are out of the x-ray, and we kind of stretch them like this so we get a really good view of the leg and the knee and any hips that we see so they're not over top of each other. And we can go ahead and take an x-ray. Good boy. So for a lot of our x-rays that we do, most of the time we're looking at the chest or the thorax or the abdomen, which is going to be kind of that stomach area. And for any lateral x-ray like this, where we can see both of those things, we'll usually position the animal on the side like this, so we can kind of get a clear view of everything that's going on the inside in a lateral position. And once they're centered, we take this x-ray just like so, like Bella's doing.
How do you ensure the safety of my cat during diagnostic imaging?
So especially if we have an awake cat, we usually have at least 2 people back here. One to kind of sit with them and make sure they're not getting too stressed out or trying to get off the table or anything like that. And just kind of to provide some moral support and some physical support, just so that we can make sure we get the x-rays done in as little amount of time as possible to kind of keep on their good side. And then the additional person's here to make sure we run the equipment properly and make sure we get everything up on the computer for the doctor to see the x-rays. Because our priority back here is their safety and also ensuring that they're not having any more stress or pain while they're here for their visit. And so that's usually why we'll have multiple people back here to ensure those types of things.
Will my cat need lab testing prior to diagnostic imaging?
Not necessarily. So if we're looking for any type of organ values, we can do some testing beforehand. We'll do a blood test. But if we kind of just want to see a general picture of what's going on inside, we can do that without having to do any blood testing. But if we want a more full picture, that's always an option that we can include.
Well, thanks for helping us out today, Bella and Jordan. If you have any questions regarding cat diagnostic imaging, please give us a call. We would love to hear from you.